Just miles from the busy, relatively affluent towns that line the road to Machu Picchu, you can find tiny villages that exist much like they have for hundreds of years. Yet these places are changing fast. Schools are being built, and many are slated to receive electricity. However, one very important area of neglect is the health of these local populations. Given the geography of the area, a visit from a medical professional can involve hours or even days of difficult travel. During the rainy season, these villages are often only accessible by foot or horse.
The idea is to bring healthcare to rural, isolated areas. Most of these communities are walking distance 4 to 5 hours from Ollantaytambo. And most of the people are not willing to walk 4 to 5 hours when they're sick. And ultimately, at the end of the day, then people get sicker and sicker for things that could have been treated quite easily. Where we provide not only medicines, but we provide breakfast, we provide fluoride treatments, we provide education on hand washing. It's all about a holistic approach to health.
The Awamaki Mobile Health Clinic seeks to visit remote villages once a month. The program currently consists of a number of individual parts designed to work together to improve the overall health of the population. Chocolatada. This key part of the campaign provides a warm, satisfying meal for all individuals who visit the mobile clinic. The most important function of the chocolatada is encouraging people to visit the clinic. A free, warm meal in these areas is a huge draw, and the chocolatada attracts people who might not otherwise consider visiting.
That's a good one.
Hand washing. The first step for all individuals visiting the mobile health clinic is instruction on proper hand washing techniques. Healthcare in these communities begins with the basics, and hand washing is mandatory for all people wishing to see a health professional. It is also required if one wants a delicious chocolatada. Fluoride. Modern dental care is virtually non-existent in these communities. As sodas and candy continue to make their way into these communities, dental care will become even more of an issue. The simple application of fluoride is given to all visitors. Another must-do before seeing the doctor. When possible, fluoride is also administered in the schools. This is often the cutest job to get assigned.
No!
The clinic.
We set up our clinic in the schools. We divide up an area so there's patient privacy is preserved, that we can get a good history and confidence from each patient.
The most recent mobile clinic trip saw over 100 patients in 3 communities over 4 days. The group spent 2 hours in a car, 12 hours in the saddle,
Must stay in the mountains.
and 3 nights in schoolhouses or clinics. New challenges present themselves daily. When the keys to the room where the clinic is to be set up and where the group is to sleep are nowhere to be found, the doctor needs to be pretty handy with a hacksaw. The pharmacist is also the cook.
The trucha.
Oh!
How was that, Nick?
Fantastic.
No me gusta.
Staff from Awamaki's weaving project not only provide introductions to villagers, but they take over as receptionists and will even take blood pressure. For a few extra soles a day, a horse guide will gladly translate your Spanish to Quechua. Issues you'll see span all of the medical map. Parents complaining their child doesn't run fast enough, tumors the size of baseballs, and the standard parasites and infections. Many people have lived with pain for years, and since most communities make a living farming, repetitive injuries are very common. In addition to required medicine, Prescriptions often include basics, like taking a 5-minute break from work and drinking more water. As the program progresses, our attention will turn to education and enabling.
There's a huge need for more education on personal hygiene, on daily living, like activities such as like getting smoke out of their house and minimizing respiratory infections.
Ideally, Peruvians will be taking care of Peruvians, and the mobile clinic will become redundant. One vision includes native Quechua-speaking nurses who can travel between the communities on a regular schedule, seeing patients at regular intervals and establishing strong relationships with the communities. In its present state, and when looking to the future, Awamaki Health's mobile clinic needs your help. We need medical supplies, we need volunteers, and most of all, we need financial support.